Welcome to the Dr. Tunishai Ford Show. Our show today is going to examine the subject of cancer and why people get the kind of cancers that they get. And I am so honored to have this special guest. His name is Mr. Lonnie Sorrells. He is a research analyst for cancer. He works with Hermanos Cancer Institute. Thank you so much for being a guest today. Thank you.
Thank you.
Thank you so much. Everything. Mr. Sorrells, this is a very, very touchy subject for me because I am a cancer survivor. I was in the fourth and last stage of the cancer. And I'm so honored that you decided to be a guest because in talking with you previously, we had some conversations about some things, and I want you to share that with our viewing audience. So the first thing I want to ask you, and this is really an important question because I know when I hear the word cancer, you think about, okay, it's either here or it's there, but you don't really know what it is. So tell me, what is cancer?
Okay. What cancer is a cell that's gone awry. It's lost either the ability to die or it is reproducing at a time when you no longer need cells. So in any of those cases, what happens is you get a growth of a dysfunctional cell that can no longer do its job because it's only there to reproduce.
Oh, okay, so we talk about benign tumors and cancer tumors. Now, benign tumor is still a tumor.
Yeah, they're both tumors,
okay.
But every tumor is not cancer. And they're divided between benign and malignant. Benign tumors stay in the place where they develop and they don't invade other tissues. So that's the difference between a benign tumor and a malignant tumor. A malignant tumor will either spread to other tissues or other places in the body, or it will invade adjacent tissue.
But now, is the benign tumor can it still be dangerous?
They're usually self-limiting and can be removed safely, and typically you won't have any long-term consequences from benign tumors.
Okay, now, you made a statement when we talked. You said that everybody has cancer cells inside of them, but everybody may not get cancer. Okay, explain that.
Yeah, and what I meant by that is that every cell in your body has to reproduce, then it functions for a while, and it dies. At certain times, during reproduction, a cell can be made poorly. A mistake is made in decoding the DNA. When that happens, that cell changes its function, and some of those changes are carcinogenic, which means it turns into a cancer cell. When your body sees these errors in development for those cells, what it does is there are mechanisms that are designed to recognize those cells and eliminate them. Some die spontaneously. Sometimes the immune system goes in and attacks those cells. Okay. But they are eliminated from the body and you go on producing regular functional cells again. And so you never know that bad cell has happened.
Okay, now you talked about the immune system. Now, the kind of cancer that I had was called Hodgkin's disease, the cancer of the lymphatic system. Now, correct me if I'm wrong. When I did my little research, the lymphatic system is actually the system that wards off diseases. Is it like the first line of defense in the body for diseases? Now, so that means that my defense system was sick.
That's right.
Wow, isn't that something?
Yeah. Cancers are typically organized into the types of tissue that they attack. Carcinomas attack skin cells and the lining of internal organs. Sarcomas affect connecting tissue, muscles, bone, that sort of thing. Leukemia are the cancers of the blood system and blood making, so you're talking about bone marrow. Lymphomas and myelomas are cancers of the immune system, which is Hodgkin's is one of those. And then there are the central nervous system cancers, which are brain cells in the spinal column as well.
Okay, now, this is really interesting because out of all the cancers that I could have gotten, I remember talking to a nurse. Well, actually, my sister talked to the nurse, and she said that if you have to get a cancer, get Hodgkin's because it's the easiest to treat. But now I almost left here, I almost died 2 or 3 times because my white count cell was so high. You know what I'm saying? They had to wear a mask and a robe when they had to come and see me. And so what was going inside, what was going on in my body that my white count was so low?
Well, while you're being treated for cancer, typical treatments are radiation, chemotherapy, and surgery. And what these things do are they destroy the cancer cells. But most of them are not very specific. So they will destroy similar cells in the area that they come in contact with. So when they go after the cancer cells in your lymphatic system, which is your immune system, they're not just killing cancer cells. They're killing other functioning lymphatic cells as well, which means that while your treatment is going on, you're susceptible to a lot of different types of infections because your white cells, your lymphocytes, are being destroyed by the treatment that's trying to save you.
Okay, why did I get... Okay, let me rephrase that, because I know you're going to go with genetics. Now let me give you a little history. My father was diagnosed with lymphoma cancer. Now I just recently found out it was Hodgkin's. I didn't know it was Hodgkin's. I thought it was just lymphoma, because there is a form of just lymphoma cancer, right? So I thought it was just lymphoma. But I learned later on that it was Hodgkin's. So the question that I want to ask is pretty much, I'm answering my own question because I know what you're going to say. But this is the question. If my father was the first person that I know of in the family that had that disease, so could it have been like generational? Because my grandmother on my paternal side, she had cancer also, but it was of the bowels. So far as I know, my father was the first person in the family with Hodgkin's. So you're going to tell me it was generation? It was DNA or generation?
I am going to tell you that no one knows.
Okay, no one knows. Okay.
What happens is that there are some types of cancers that are definitely genetic.
Okay.
But usually those show up in children. Cancers, Hodgkin's to be specific, the cause of it is unknown, but they know that it's associated sometimes with the Epstein-Barr virus, so that if you've had an infection, and that causes mononucleosis, for instance.
Mononucleosis, okay, what is that? I'm not...
infectious mononucleosis, it's called the kissing disease when you're in high school.
Oh, mono, okay, mono. Okay, you made me up there, okay.
Okay, so the Epstein-Barr virus causes that, but people who developed Hodgkin's frequently have had that infection first. There are a couple of different infections that can cause cancers, that are associated with cancers. The other one is human papillomavirus, which causes cervical cancer, and that's the one that they've actually developed a vaccine for. Will be going into phase 1 clinical trials soon. At Carmanos, where I work, it's one of the 40 designated comprehensive cancer centers in the United States. There are only 40. There are 2 in Michigan. And at Carmanos, we only treat cancer. And so what we also do, though, is we have a clinical trials as part of that, which allows patients who are in latter stages where standard of care doesn't work for them or doesn't offer them a lot of hope. There are these phase 1 trials which offer access to cutting-edge techniques and drugs that you can't get anywhere else.
Because I know my treatment was very, very invasive. I mean, I think I had the strongest chemo and radiation treatment you can have, because I had the tumor in my chest. It was a 9 centimeters, and I had one on my spine. Now I was in the 4th and last stage of the cancer.
That's right, and you told me about that. And yeah, cancers they're both graded and staged. Now you get a grade based upon how different that cancer cell is from what the normal cell should look like. And those grades go from A through E. But then you have the stage, and the stages are determined by how localized the cancer is, whether or not it's, for instance, in a lymphomic cancer, is it just isolated in one node?
I want you to hold that thought, because we're gonna take a commercial break, and we'll be right back, and we're going to finish answering that question for me. Okay? So we'll be back in a few moments after this commercial break. Thank you.
I was diagnosed with leukemia. I thought it was over.
I wasn't willing to accept that. I searched online for the best doctors in the country. I found one right here at Carmanos.
He not only cured me,
He even helped our children understand.
Carmanos is a comprehensive cancer center. They work as a team.
Just like we do.
I'm Tony Kinsey, leukemia survivor. If you've been diagnosed with leukemia, don't give up. Email or call 1-800-COMMANDOS today.
Rough Dog ENT showing you so much love that you can download our mixtape 2.5 for free. That's right, for free on TheDr.TunishaiFordShow1.mp4. Rough Dog Entertainment showing you so much love that you can download our mixtape 2.5 for free on DatPiff.com. That's DATPIFF.com. 3.0 coming soon. Rough Dog Entertainment. Don't be mad cause you ain't it. Check us out on Facebook, Moco Space, and YouTube. RUFFDOGGENT. You're sleeping on Rough Dog Entertainment. The package, the album, is in stores right now, featuring songs like Facebook Pro, D-Boy Thing, and we know y'all love that Chevy Sitting High. You can also download it on iTunes or Amazon. And check us out on Facebook, Moco Space, and YouTube. Rough Dog ENT. RUFFDOGGENT.
My name is Dr. Chosen Andrew Fregner. I'm a board-certified medical oncologist. I work within the Detroit Medical System Oncology Division, part of internal medicine. I run a private practice for oncology, and I treat almost all cancer types. During our interview, we had a prolonged discussion, at which time she made it known to me that a family member of her had lymphoma. During my evaluation of her anemia, I found her to have a lymph node, which is a swollen gland, for which I sent her for a biopsy. It was this biopsy that confirmed to us that she had a diagnosis of malignant Hodgkin's lymphoma, which is a type of cancer of the lymph nodes. Continued association with Ms. Ford with what I would consider a series of unfortunate events that unfolded thereafter. After securing a diagnosis of cancer, I got a hasty call from her one morning where I recall her telling me while she was teaching in class, her legs were giving out on her. This was very highly alarming with her recent diagnosis of cancer, lymphoma. I urged her to proceed immediately without hesitation to the emergency room, which she did. Upon arrival at the hospital, my fears were confirmed. She did have a cord compression, which is the tumor was pressing on a spinal cord, and this was causing paralysis, almost like the spinal cord being choked out. We hurriedly started her on some medications and treatments, and thankfully she responded well to treatment, and today she's cured without any signs of paralysis at all. Well, Dr. Ford and myself have an unusual relationship. I mean, this was really involved not just myself, herself, her sister Diane, and her mother. I remember her mother dearly. Her mother came with her on all occasions for her cancer treatment with her sailor hat. She was a very compliant patient, very, very good patient.
If you're just tuning in, my guest today is Mr. Lonnie Sorrells. He is a research analyst for cancer. And I just asked him about the lymphatic cancer that I was diagnosed with. He was explaining to me about the stages. And I told you that I was in the fourth and last stage. Okay, you can go ahead and continue, please.
So for Hodgkin's, the first stage is whether or not it's in one or more nodes. If it's isolated to one node, you've got stage 1. If you've got 2 nodes involved and they're both above the diaphragm, then it's a stage 2. If that cancer has 2 nodes involved and one of them is above the diaphragm and one is below the diaphragm, you've got stage 3.
Okay.
Stage 4 means that you've got that situation going on where you've got a node involved above the diaphragm, a node involved below the diaphragm, and it's in an extra lymphatic site.
Okay.
So that could be it's gone to the spleen or
I was in my spinal column.
Or spinal column.
Okay,
right,
L4,
exactly.
L5.
That's right. And so that's what jumped you up to the stage 4.
Hey, I was a lucky one, huh?
That's right.
All right, I was privileged. Oh, wow. Let's take this in another direction. Now, I don't know how you feel about these things, but I am a believer that we can open up doors. Okay, because you said to me earlier that we don't know why you get certain cancers. Because I'm looking at, here's a woman who may have breast cancer, here's a person who may have pancreatic cancer, here's a person who may have prostate cancer. It's like, so what are we doing? And I know this might be just your opinion, okay? It's not going to be based on anything fact, but I just want to kick it with you. What do you think we're doing to attract certain type of cancers? Because I remember we had a conversation, I told you there was a little boy that I know, he hurt his arm. He had an injury. And then soon afterwards, he had cancer in that area. So is it something that we can do that may be stimulating a particular cancer, attacking a certain part of our body?
Right. We do know that there are a lot of different triggers that can cause cancer.
That's a good one, okay.
We have, there are certain chemicals that are called mutagenic, and which means that they actually make changes in the DNA. Some of those chemicals, mutagenic chemicals, are carcinogenic, which means the changes in the DNA that they make particularly will cause cancer. Now, for instance, some of the heavy metals like cadmium, if you breathe the fumes, that will cause a cancer. Okay. Nickel is another metal.
So, work environment, things like that, this can charge. Okay.
Exposure to phenols, benzene-type chemicals, a lot of very powerful organic chemicals. Those can cause cancer. They're associated with cancer. Smoke, of course, but asbestos. And some of these, and when we talk about why did I get cancer, one of the things is, for instance, with asbestos, the cancer in your lung could have come from exposure to asbestos 30 years ago. So in the meanwhile, you might get hit by a bus.
Okay.
But eventually, that exposure to asbestos will end up with mesothelioma, which is a lung cancer that's specific to...
So it was incubating. It was incubating.
Incubating or lying dormant.
Okay. So you had a trigger, a stimulant.
Right, waiting for something else to happen. Maybe waiting for... It may be creating those bad cells all along. But your immune system, you're young, you're healthy, and your immune system is kicking in, so it's reaching a point where, oh, there's a bad one, got it, wipe it out, it's gone. As you get older, your immune system gets older, and so the same things that it was able to do in the past, just like everything else we do, as we get older, it doesn't do it as well.
Okay, let me give you my story. Now, in '98, I'm living high. I have a dream job, love my job. I had a new car, and there's a new beau in my life. Wonderful life. My son was 18, getting ready to graduate from high school. Now, I guess it was a little stressful, but I thought it was a good stress. So I decided to go and have a physical, because I'm a motivational speaker, and I want to be an example to the other women. I have my physical. And next thing I know, the doctor's telling me, oh, you're the picture of health. He examined me, my lymph nodes and everything is fine. 2 weeks later, Mr. Sorrells, 2 weeks, I started experiencing this excruciating pain. So, my question is, are you saying that it was laying dormant, so as soon as I saw the doctor, this pain starts hitting me? So what did I do to stimulate all this pain? Or it just became awakened at that time?
Well, it was probably in early stages of cancer. You probably already had it then. And I can say that because 2 weeks is a long time.
So
it's a short period.
So I had cancer when I saw the doctor, but he examined my lymph nodes.
But see, the first stage is asymptomatic.
Okay.
And so usually people rarely find cancers in stage 1 because they don't have any symptoms, they don't know anything. They don't notice that they have it because, remember, it starts out as a single cell.
Right.
And then as it grows, as it gets bigger, and it starts pressing against other things, it starts interfering with the way the body should be working because it's taking the place of a cell that you need.
Okay, I want to ask another question. Now, I had an opportunity to do a speech or a workshop at the Monroe Bank and Trust in downriver, and it was a emotional wellness. And one of the things I talked about was stress. So a lot of things that we talked about were the external factors. What about the internal factors? Like, for example, I know at that time I I was doing well, financially. I was doing well in terms of what my life, but I believe I had a lot of unforgiveness. I was a lot of anxiety in my life, stress, and maybe I say it was good stress, but stress is stress. And I know that one of the things I discovered through my research was that when you are under a lot of stress, your immune system can slow down or shut down for up to 6 hours. So I guess my question to you is, do you believe, or have they been doing research on internal factors that may cause cancer, like anxiety, like unforgiveness, stress, just anger, things like that? Can those things also be stimulants to cause cancer?
Well, definitely stress
Okay.
can reduce the effectiveness of the immune system. So what that means is that in the case of a Hodgkin's, even though the cancer is in the immune system, there are functioning immune cells that are working as well. And their job is to go in and find that non-functional even part of them in themselves and correct it. Now, if your immune system is weakened because of stress or because of diet or other things, then it no longer functions that policing ability, and so that allows the cancer to progress.
Okay.
So stress doesn't necessarily cause the cancer, but it can prevent it from being corrected.
Okay, this is one of the reasons why I wrote this book. This is a comma in your life, not a period, because I talk about some of the findings that I found. I deal with the emotional and psychological factors of cancer because, of course, I'm not a doctor. So I could not do any research where I can find out why it's happening to us on a medical issue or a medical level. But I found that this book is going to really help a lot of people because it talks about different things I found out in terms of how we should live our lives, how we should try to stay stress-free, how we should be walking in forgiveness and things like that. So this is a real good book that I'm hoping that I will be able to push and give people an idea of what we should be doing to deal with the inner person.
Well, I think lifestyle is a very important aspect of preventing cancer.
Lifestyle is very important.
Because one of the things we do is, I know we've had those experiences where you're watching the news and you hear that a brick has fallen off the bridge and fallen into a car, and suddenly the next time you're driving under a bridge, you look up and say, okay, there's nothing there, because I don't want that brick to fall in and kill me. Well, with cancer, sometimes we see it happen, affect people in our lives or things, and we say, oh, I'm going to stop smoking. I'm going to calm down. I'm going to do all these things that can help me prevent cancer from coming, help my body stay in a good mode.
Okay.
But what happens is, just like eventually as you drive down the freeway, you stop looking up at the bridge because nothing was happening, and you don't think any. Eventually we fall back into those habits that will bring on cancer. So it has to be a lifestyle adjustment is the best preventative measure for cancer. What am I being exposed to? I have to remove those things that are exposing me to cancer. I have to maybe change my diet, especially if I have a risk factor for cancer. One of the things that, because we don't know what actually causes particular cancers, we talk about the risk factors that people have for certain cancers.
Okay, I want to talk about one more thing before we leave. Survivor University. Can you explain what that is?
Okay, at Cromanos, they have developed a curriculum for people who have had cancer, for their families, of courses that help them change their lives and develop better lifestyles to deal with that cancer. So one of them is like Tai Chi, which is I believe it's an Asian martial art that people exercise. So it allows you to relax and it focuses the mind and brings a certain calmness to you. There are courses in how to select Medicare and the different types of programs that are available. There are dietary programs. There are programs to help you learn how to change your lifestyle, lose weight. They found out recently, they've started focusing on the fact that obesity is a risk factor for cancer as well.
Okay.
So all of these things are there to help you not just survive cancer now, but to overcome it and not allow it to back into
So
your life.
how long was this going on? Because when I had cancer, I had never heard of the Survivor University.
Yes, the Survivor University is a fairly new thing that we've started at Carmanos. It's been within the last 5 years.
Okay.
So.
Okay, well, you know what? I really think we had a wonderful interview. You gave us a lot of information and everything, and I'm just honored that you were able to join us today.
Well, I really enjoyed it. Thanks for asking.
Thank you so much for being on our show. We'll be back with inspirational thoughts from Dr. Tunishai Ford.
When I was diagnosed with leukemia, I thought it was over.
I wasn't willing to accept that. I searched online for the best doctors in the country. I found one right here at Carmanos.
He not only cured me,
He even helped our children understand,
Carmanos is a comprehensive cancer center. They work as a team.
just like we do.
I'm Tony Kinsey, leukemia survivor. If you've been diagnosed with leukemia, don't give up. Email or call 1-800-CARMANOS today.
You're sleeping on Rough Dog Entertainment. The package, the album, is in stores right now, featuring songs like Facebook Pro, D-Boy Thing, and we know y'all love that Chevy Sitting High. You can also download it on iTunes or Amazon, and check us out on Facebook, Moco Space, and YouTube. Rough Dog ENT, RUFFDOGGENT.
Cancer runs in my family. In fact, I'm the oldest living female in 5 generations. Still, I wasn't prepared to hear I had colon cancer. Luckily, the team at Carmanos was. They moved fast. Within days, I had minimally invasive surgery. And today, I live a completely normal life. I'm Trish Krause, colon cancer survivor. If you've been diagnosed with colon cancer, email or call 1-800-CARMANOS. I want you to survive too.
Welcome back to my inspirational thought for today. Most of you are probably familiar with the prodigal son. You know, he's the one who left home and squandered all of his inheritance. But maybe you don't know about the guy who stayed home. That was his brother. But he learned that through obedience and making good choices, those are the keys to prosperity and happiness. So if you want to experience true prosperity and happiness, be like the son who stayed home. Be obedient to the laws of the land and obedient to God's word, and you shall prosper and experience happiness. Thank you for joining me. And I want to tell you to love God and love your neighbor as you love yourself. God bless.